And there are data behind patients with mismatch repair protein deficient colorectal adenocarcinoma not responding to chemotherapy in the metastatic setting, and this is also seen in gastric cancer as well. So there are some studies pointing to this fact as well. So we looked at our patients with Lynch syndrome or mismatch deficient, protein deficient rectal cancer, and we found 51 patients overall. A portion of those patients just went on to surgery, did very well, they had early disease. 15 of the patients had chemoradiation up front, responded very well, which has also been published. But our patients that received induction or neoadjuvant, so upfront chemotherapy, either with FOLFOX or with capecitabine and oxaliplatin, we noted that 26% of them actually had progression of disease, which is really quite scary for rectal cancer because we typically expect very good responses to induction chemotherapy. And so we looked back at our data that we had published in the group as a whole and in mismatch repair protein proficient or MSS rectal cancer patients, and saw that none of those patients actually progressed. So this is a striking difference between the two groups. And when the patients that progressed on FOLFOX went on to receive, in our cohort, went on to receive chemoradiation, they responded well to chemoradiation. But a portion of them developed very rapid disease recurrence. And so the take-home point of this study, of this retrospective analysis, was that really we should be checking immunohistochemistry for locally advanced rectal cancer patients because a small portion of them do have mismatch repair protein deficiency. It's probably about 5% or so of all rectal cancers. If a person has known Lynch syndrome or is MSI high by next generation sequencing, then they really should not get upfront chemotherapy. They should proceed with upfront chemoradiation until we have better treatment available for them.